Welcome to the webinar today hosted by Lab to Doctors. I am Dr. Chelsea Vormer. I am the founder of Lab to Doctors. Lab to Doctors is a platform that was born out of the need to address pre-analytical errors in lab testing. Pre-analytical errors basically are the errors that happen that are introduced into your lab samples before the samples even get to the lab. They begin from the phase of ordering the wrong test to transporting the sample that has already been compromised in the lab. In the lab, we deal with analytical errors, but this platform deals with pre-analytical errors. You may wonder why pre-analytical errors. It's pre-analytical errors because as much as the lab is not very error prone, 70% of the errors that originate from lab results and lead to misdiagnosis are due to pre-analytical errors. So considering that the lab is very automated, considering that with automation, AI, and everything that we have going on in the lab, procedures, training, we've been able to greatly reduce errors within the lab to insignificant quantities. Yet, we are unable to address the errors that happen out of the confines of the lab. They call them pre-analytical errors. They call them lab errors, even when they do not occur within the lab. And we believe that through this platform, we'll be able to greatly reduce the errors or even eliminate these errors before the patients go for their lab samples to be collected. Today with me, I have a smart lab director. Her name is Dr. Fur. I'm going to let her introduce herself further as we go on. Caroline, over to you.
Yes. Hey, everybody. My name is Dr. Fur. I'm a board-certified medical lab scientist and also specialist in blood banking. I hold a doctorate in clinical lab science and master's in transfusion medicine. My professional interests mostly focus on transfusion medicine and preventative cardiology, specifically advanced lipid profiling, but also optimizing test interpretation and utilization in the rural care setting. So I am a big believer in interdisciplinary patient care teams, and the lab obviously is part of that. So I'm excited that we have professionals from a couple of different areas of the medical field on this call today.
Thank you, Caroline. And again, just so you know, I have 14 plus years of experience in lab medicine. I started in the lab from collecting blood. So from a phlebotomist, I went on to testing the samples and went on to have my doctorate and a fellowship in lab medicine in clinical pathology, where we currently are the ones who direct labs, design the test, validate them, and ensure the quality of this test, and go even further to troubleshoot the lab results and interpret the lab results. So those are all the things that we do as medical lab professionals. We are going to go on to, it's going to be an interactive session. It's going to be a session. So feel free to, follow up with us as we ask some questions that would hopefully open up your minds as you think about the experiences you have had with the labs that you are exposed to. So, Caroline, we are going to begin the Q&A session right now. Okay. Mm-hmm. Let me pull up the questions real quick. Second. Okay, so the first question that we have is through these questions, we hope to open your minds to let you know, to communicate to you about the real world of lab medicine. And so you can look at it through your own lenses, listen to us, and be able to appreciate what we do in the lab and how these errors happen that you as a patient, a caregiver, a clinician, a pharmacist, a legal nurse, a patient advocate could avoid them. So the first question is, Carolyn, why do lab results sometimes feel like just a list of numbers to non-lab professionals? And what do we often miss behind those numbers?
Sure. So when you look at lab reports, they're sort of shorthand, right? We will turn out a numeric value that comes with units and then also hopefully reference ranges. And sometimes, that can feel like just a string of characters. What's usually missed is the context, and that includes when and how the sample was collected, but also obviously the patient's medical history, medications, and whether the specimen was handled correctly. And then also whether the result is part of a trend or just a standalone result. So all of those pieces can ultimately change the meaning of the number and the characters, that we turn out on a report. And I can give a couple of examples for this. For example, when you look at testosterone levels, that's a very popular test for our male patients nowadays. The reference range that we turn out with that numeric value is usually based on the expected daily peak testosterone levels, and that's usually reached before 8 a.m. As you go through the day and you complete your tasks or whatnot you're up to, those testosterone levels typically decline. So if we're turning out a lab result on a male patient and we flag the testosterone level as low because it's below the reference range, it's important to even then go back to the pre-analytical phase and consider when that sample was collected. Did that patient come in at 8 a.m. before you did anything, or has that patient been building a fence, manual labor all day, came in at 5 o'clock and we drew the sample then? So that is all things that we do not mention in our lab report that the provider may not be aware of when they just simply look at the number.
It's wonderful. To add to what she has said, every lab test, when it's manufactured, comes with its limitations. And what we do not have in lab reports are the limitations of the lab tests that we carry on, we perform in the lab. And you could have limitations as simple as someone who takes aspirin should not drink aspirin prior to performing this lab test or prior to providing a lab sample. When the requisition is sent to the lab, we do not see aspirin on the requisition. Even if the lab sees the aspirin, there's really nothing we can do but to communicate the clinician. So it is at the level of the clinician, the nurse practitioner, whoever is placing this lab test order, to ensure that the patient is properly prepared. And sometimes properly prepared doesn't only mean asking the patient. It also means reaching out to the lab. I need to order this test. Are there some things that my patient should avoid prior to this test? Because the other thing you need to know is that you could be ordering potassium from lab A. Potassium in lab A uses a different method from potassium test in lab B. So it's very important that you know what the method is and if that method really works with your patient's lifestyle. Because sometimes your patient could be on some medicine that is not needed for people who test with method A, but it's okay with method B. These are the details that clinicians do not get, nurse practitioners do not get, because especially when you don't call the lab to find out. If you don't call the lab, you will not get this information. And that means that the patient will not be properly prepared, and then the lab results will be compromised.
Yeah, those
Caroline,
are, yeah, definitely very good points. We'll move on to the next question on our list. In your experience, Dr. Chessie, how much do pre-analytical steps, collecting and sample handling, really impact accuracy?
Yeah, I think that the bulk of the 70% of medical misdiagnoses that are as a result of pre-analytical errors, I believe that the bulk of these results are from the sample collection phase. Because if a patient is not properly prepared prior to collecting the sample, you are already introducing errors, you're already introducing something that would interfere with the test method and compromise the lab results. So, and it would be as simple as someone who went jogging before performing a lab test. So meaning that they jogged and they were dehydrated. And so the concentration of things that we need to measure would tend to be higher than expected, just because it's somebody who went jogging before the sample was collected. How about someone who eats some, let's say asparagus has a lot of potassium in it. What if you eat a lot of asparagus to the extent that it increases your potassium levels? Did you tell the clinician who was ordering it? Did the clinician reach out to the lab to tell us to help him or her prepare the patient? Not even just the clinician, even at the level of nurse practitioners. I've had the opportunity to chat with a lot of them, and it turns out that there's not enough lab training that they get. And I would want to say that it's very important that we do not think that the lab is only a place to perform testing. We are there to help you ensure that you collect the right samples. We are there to make sure that the patient is properly prepared so that the right samples get to the lab and you can better treat your patient. You don't want to treat a sample, you want to treat the patient. And it begins by collecting the right sample. So yes, I think sample collection, sample transportation, sample storage, it's all about the sample. They have a huge role in playing in eliminating errors that contribute to the 70% of pre-analytical errors in the laboratory medicine space. Do you have anything to add to that?
Yes, so I definitely agree with that. One other thing that I would like to point out, because I've seen a lot of errors in that area, is the actual blood draw itself. So that skill, phlebotomy, is taught in many different professions, right? Nurses learn it. Nurse practitioners obviously have already been through that step. Even providers should know how to draw blood. And then, of course, you have your phlebotomists that's their main job duty is to draw blood. But even the way how the sample is collected can also greatly affect the lab results we get. And one thing that people are not aware of is prolonged tourniquet application. So even if you leave the tourniquet in place for longer than 1 minute, and we just had that recently happen in our healthcare system, that we kept getting a variety of elevated potassium results that just did not make clinical sense for the patient. So we started investigating, and it turned out that a newer nurse was collecting those samples. She was still fairly insecure in her skill. So she just kept the tourniquet in place for a couple of minutes to make sure she could feel the vein and she was in the right position and whatnot. But that led, to all the cells being stuck in place, and that affects their physiological state. So in essence, it falsified the lab results we were getting just from improper technique. So all of that is important, that it's not just the goal to get blood in a tube, but also to do it correctly to produce reliable results.
And to add to what you've said, it's not only the nurses. I've also had phlebotomists do my blood draw and leave the tourniquet there until I tell them you need to take it out. When you start collecting the blood, you need to release it. You don't collect my blood with the tourniquet so tight because it's going to cause hemolysis. So I also want to say that the training that phlebotomists receive doesn't empower them to be able to know exactly what method to use in drawing the blood, to be mindful of what analyte they are drawing for. For example, if you're collecting blood for potassium testing versus cardiac biomarkers, or an analyte that needs to be put on ice, sometimes it's very important that I believe it's very important that phlebotomists get more training so that they're actually mindful of what they're doing. I think it's not fair or right that a patient has to remind them that you need to release the tourniquet. And sometimes even they say, this is the way I always do it. So who is to blame? This is the error beginning from your phlebotomist, from the person who is at the front door of your lab, from the person who collects the samples. So I think training is needed at every level, from the phlebotomist, from who orders the test, and who who transports the sample, error, these are all the things that contribute to the errors that that cause lab results to either be falsely high, falsely low, and cause even delayed diagnosis or misdiagnosis. So we're going to move on to the next question. Carolyn, how do you recommend bridging the gap between what the lab sees and what doctors or patients understand?
So I believe the answer to that is that test interpretation has to be a collaboration between providers, caretakers, and laboratory professionals. So for clinicians, labs should add more interpretive comments to lab results and also flag possible pre-analytical issues, right? Right now, everybody's familiar probably with the high and low flags on results, but the lab typically doesn't offer an explanation for that, even though oftentimes they do have some valid, possible solutions. So the lab definitely needs to be more available for quick on-demand consults. And on the flip side, provider also have to be aware that there are comments and that the lab can be a resource and offer solutions, and they have to take the time and read those comments and reach out to the lab for clarification if they're concerned about a certain result. And then for patients and caregivers, the lab should provide simple patient education, just explain what a test is for, why the provider may be asking for that test, and also provide pre-test requirements. Fasting is kind of sort of a thing of the past for most lab results, but it's still relevant for some. So we definitely need to make sure the patient is aware of that. And then also timing and medication holds for certain blood draws. So I feel like the lab needs to take more responsibility and have more authority in denying blood draws for certain tests if they know the pre-test requirements were not met. And one way to achieve this would be offering visual aids and brief comments on test orders for the patient that are easy to understand, like this result may be affected by recent exercise or whatever the requirement may be.
Thank you. I'm happy that you've been making mention of education, training, education all along. And because this is exactly what Lab to Doctors was built to do. Lab to Doctors was there, like you hear the name Lab to Doctors. We are there to bridge the gap between the lab and the doctors, between the lab and the patients, between the lab and the caregivers. This information that is not readily available from the lab, either because people do not know that they have to call the lab, or that when you call the lab, there's nobody to speak to in real time, or you have to go to Google where the information is not always updated. You're not even sure when that information was there. Lab to Doctors is a platform that has medical lab professionals facing the community. If you have issues with your lab results, whether you're a patient, a caregiver, a clinician, a nurse practitioner, whoever, a patient advocate, reach out to Lab to Doctors. And we'll be able to do just what she's talking about. We have trained laboratory medicine professionals on the platform that have all the information for you. Because when you go to Google, up to date, I've visited a lot of the scientific sites out there. I realized that they do not have the information that we have. And not only that, if you put all of this information, I can just already the lab, when you receive your lab result, the paperwork already looks overwhelming. There are every type of graphs, histograms and bar graphs and everything going on. As a sick person, I don't even know what to do with it. I think that it would just be fair to make lab professionals available that can speak to someone, especially when you are the one dealing with the sickness. Talk less about a clinician or a nurse practitioner who has 30 minutes to see a patient. When do they have the time to, sometimes you have to tell the nurse to call the lab and the nurse calls the lab and there's nobody to speak up because we are so busy in the lab, we have 10,000 samples to test in a day. Again, to avoid being on the line, to avoid being put on hold in the lab, reach out to lab to doctors, and someone will reach out, would contact you and get with you to be able to address whatever concerns you have with your lab results. Whether it's the lab results, whether it's just preparing the patient before the sample is even collected, whether you have questions about, test recommendation, because sometimes we realize that people order tests not because with good intention. Unfortunately, that's not the best test for the purpose. So I believe that if you reach out to us, we can even tell you better biomarkers based on sample type, based on age, storage stability, and all the different variables that are put into play to ensure that you get the right, you're ordering the right test, and that we can manage the condition, and that we prepare the patient adequately before the sample is even collected. Then you have been empowered with accurate results to treat your patient, or the patient has been empowered with accurate results to monitor their health. So I think that lab to doctors would answer most of those questions, because truly, as a lab director, I can tell you that most of the times when people call, I'm either in a meeting or dealing with other situations in the lab, and you would hardly find a lab that is directed by more than one lab director. So if there are 10 of you who want to reach out to me at noon, your 9 people would be on the line waiting instead of just reaching out to lab to doctors. So that's really what it is. You will find many of me on the platform to take care of you, to address your concerns and ensure that you're going to have accurate results, or at least eliminate the pre-analytical errors, because I know that the errors in the lab are very insignificant, if at all there are any.
That's very true. And just so we can all have a better understanding of the process, Dr. Chesey, can you walk us through what really happens to a blood sample after it leaves the patient's arm?
So after the sample leaves the patient's arm, let's say the patient, there are 2 scenarios here. The patient could be admitted in the hospital, or the patient could be an outpatient, so somebody at home. I'm going to talk about an outpatient, because typically in the hospital setting, everything has been standardized. Why do I say standardized? They know what they feed them. No food comes from outside, right? And so in a way, the hospital knows what the patients are taking. But now if I need to have a test done and I'm sitting at home for somebody to draw my blood, once the blood is drawn, depending on the analyte that needs to be tested, it's either transported room temperature or transported on ice. We transport it on ice because we want to ensure that the analyte in that sample that needs to be tested, usually a protein may degrade if you do not transport it in ice. These biomarkers are proteins in nature. And just like eggs, when you fry your eggs, it denatures, right? It's liquid, and then you fry it and then it becomes hard. That's the same thing. When you see us put a sample in ice, we want to make sure that we are preserving the structure or the nature of the protein that we intend to measure. So the sample is going to be put under the right conditions. Hopefully you have the right phlebotomist, or the right person who drew it, to put it in ice on time, because it says that draw it and put it on ice. No, you mix it. You have to invert the tube to mix it with the anticoagulants like 5 to 10 times, and then you put it in ice, or you put it in a bag, because it's a sample that doesn't need ice. And then this sample is transported to the lab. However long this sample, whatever the distance is, sometimes the sample could be transported for about an hour before getting into the lab. Now I'm yet thinking about the car that is transporting this sample. Does that car have AC? Even the sample that is supposed to be at room temperature, it shouldn't be frying. It shouldn't be frying. But if the person transporting that sample doesn't have AC in their car, implying that they're sweating and the sample is frying, then by the time the sample gets to the lab, we are having something else altogether. Anyway, once the sample gets to the lab, sometimes the person who collects the sample prepares the sample, implying that they separate the red cells from the plasma or from the serum. And we quickly separate it, because you have this, what you are intending to measure is in the red cells. If you do not separate it, then it's going to continuously leach out into the plasma. That will not give you an accurate reading. If you want an accurate reading, once you collect that sample, you separate the red cells from the plasma so that the substance does not continuously pour itself in there. And then you're like, oh, it's so high. No, it's high because you did not separate the plasma from the red cells on time. And then, of course, when the samples are spun and everything is brought to the lab, once it gets into the lab, we scan it in, it gets into the system. Like I said, the lab is so automated. Once you scan it in, the instrument where it goes to is identified, and the technician takes it over to the instrument. And, prior to this, the instrument was already QC. QC means quality control. We've already ensured that the instrument is working okay. The reagents are working optimally. And then now we just have to load the sample on the instrument. We load the sample on the instrument, and once the results are out, because of the laboratory information system, they are automatically transmitted to the clinician, who sees it pop up on the EHR in their office because we did the test. Now, I want to tell you that garbage in, garbage out. If the right procedures are not put in place, the clinician will be receiving garbage. If the right procedures are put in place, the clinician receives accurate results that based on the symptoms of the patient, is going to look like, this is what I expected. It's confirming what the patient complained. Or my patient said, I'm weak, I'm dizzy. Those things look like anemia. And here I'm seeing the red cells are low, the iron is low, the ferritin, it goes on and on. So he's seeing the parameter as it is. But what if the sample was not transported correctly? What if it wasn't transported on time? These are some of the things that make me say, we need more education of the people who collect the samples and the people who transport the samples. If you do not want AC in your car, know the sample you're transporting is somebody's life. It's going to make decisions for somebody to either live or die. And so it's very important that that education is passed on from the doctor's office until that sample gets to the lab. So that's the journey of a sample from when it's collected until when it gets to the lab.
And I think the important thing to point out here is also that all of those pre-analytical steps, the actual lab itself, the people that run the tests and turn out the results, we're unaware most of the time what happened to the sample before I started touching it, right? So I have to work under the assumption that my specimen was collected properly and handled properly. I cannot visually see if something went awry before I ever touched the sample. So a lot of times, when you see a lab result and you just look at it and say, this does not make any clinical sense whatsoever, the immediate thought is the lab screwed up. I need to call them and tell them, that they don't know what they're doing. They did a bad job. When in reality, I have to rely on all of these pre-analytical steps to be performed properly that I have no control over. Nobody in the lab is offended if you call and tell them, hey, this result does not make sense. Is there a way we can get a redraw? And that usually is a very reasonable request and a good approach without assigning blame. There are so many steps that nobody really has control over the whole thing. And, we just all need to work together and find a solution for that.
And to add to that, usually these pre-analytical errors steps we are talking about, fast forward when the results come and the clinician is questioning, the patient doesn't even remember what happened. What did I eat? What did I do that day? Did I sleep late? Did I drink some soda before sleeping? The patient doesn't, it's now like 3 to 5 days. Usually they say 5 to 7 business days to get your results. So within this period, the patient doesn't remember what happened. But guess what? On the Lab to Doctors platform, if we prepare you, we collect that information in advance of preparing you so that when the results come up and you have questions, we don't need to bother the patient about what they did before the sample collection because we already have that information, and that facilitates troubleshooting those results accurately without relying on memory that is lost from the patient because the patient doesn't remember what happened 5 to 7 business days ago. So we're going to move on to the next question. Caroline, what are critical points between collection and reporting that clinicians or patients aren't aware of?
Yes, so I think we've touched on a lot of these, so we will probably move through it fairly quickly. But one is the collection technique that we already talked about. For example, the tourniquet application, and if how you disinfect with alcohol. Do you let it evaporate before you actually stick the patient? All those sorts of things. Then also the selection of proper collection tubes. And I mean, you would be amazed by the things that I have witnessed. I mean, I have seen people collect a sample in a purple top on accident that should have been a green top to avoid having to stick the patient again and not to have to admit their mistake. They just poured it over into a green top. And that's just, that will greatly falsify your results. I mean, that particular mistake will make it look like your patient is dying when they're perfectly fine. But that really is, it's not just the color of the tube. There is reasoning behind what we request and require. Then also the processing part, a lot of people think we take the samples, just stick them on the analyzer and wait for a number to come out on the other end, but there's pretty extensive processing going on in between. So the samples have to be centrifuged down in most cases. That lets us separate either the plasma or the serum. And yes, there is a difference between those two as well. So that has to be done properly. And then also, in a lot of cases, samples have to be aliquoted, transferred into special test tubes, frozen, you name it. Like there's so many manual techniques still involved in processing and modifying your sample before you actually analyze it. The other thing is also the transport conditions. You talked about temperature a lot earlier. That certainly is important and also something we cannot prove. I don't know if that sample was consistently at the right temperature or if it got hot in between where it was drawn and coming to the lab, but they cooled it back down before they handed it over, so they, didn't have to admit they made a mistake. And then also analyzer QC and calibration. So that's what's a very abstract concept to most providers. So all of my analyzers, I have to prove that they're working properly, at least every 24 hours of testing. For some analytes, even more often, every 8 hours of testing or whatever the requirement is. That means I stick a liquid on there that comes from a commercial manufacturer that I know what the result should be. I have a certain margin of error, but my analyzer has to turn out the right result on that liquid. And that's how I can prove that my analyzer is working correctly. Now, the more and more accurate and precise our analyzers become, that's certainly a great thing for picking up minor trends and monitoring patient conditions and diagnosis and everything. However, it also greatly increases how finicky those analyzers are. So in my lab, which the lab I oversee is not even very big, but I never have a day where all of my QC passes on the first try. We always have to recalibrate something, change the reagent on board, troubleshoot. All of that takes up time. So when you call the lab and ask why are my results taking so long, what's going on, and they tell you, well, QC didn't pass for that analyte, I have to hold it. It's not to, make anybody's life harder or hold back results. It's if my QC doesn't pass, I cannot guarantee you that your patient result is accurate. So all of these are intra-lab measures to make sure that we're turning out reliable and accurate results. And then also one thing that many people don't realize is that we do have some degree of AI support in the lab and have had it for a long time. So analyzers will flag samples that turn out results that don't make physiological sense, that are far, far off from what is a known baseline value for the patient. And somebody in the lab with professional training will review all those results, make sure everything on the analyzer is correct, looks correct on our side. We're confident that the technical process was correct, and sometimes we even follow up with the provider from our side, asking if we should turn out the result or if we're so far out and this doesn't make sense at all, and we should at this point cease testing on the sample and recollect it.
Wonderful. Thank you. I think you've said it all. We're moving on to the next question.
All right. Yeah, what are some simple tips non-lab professionals can use to better read and understand lab reports?
Yeah, when you say non-lab professionals, I want to put aside patients because I know clinicians, I know nurse practitioners who order this test. To an extent, I know about reference ranges, and so they measure, they look, they ensure that the result was high or low based on abnormal or normal based on the reference range. But there's also something that an abnormal always doesn't, there are results that occur in the gray zone. It's somewhere in the middle of normal and abnormal. And so it either falls into abnormal or normal. Just, like when you're looking at 49.9, we have those kind of results that sometimes this kind of results are resulted as indeterminate. These are the results that I would tell clinicians or nurse practitioners or who order these results to reach out to the lab and have a better understanding of what indeterminate means, because this is the gray zone of that lab test. This is where this is where there's either a difference, a slight difference to make it positive or negative, but it's not in any of those zones. Usually this happens with immunoassays, with antibodies and antigen tests. So I would say that instead of trying to teach people how to read these results, when you get these results and you really cannot make sense out of it, reach out to a medical lab professional. Any of us can do it. I don't need to be in the lab that tested your sample to be able to understand your lab results. Because when the lab results come, sometimes the results are based on your age. So you don't just look at your number and the reference range. It's going to tell you that for an infant, for a toddler, for an adult, for a teenager, for a male, a female, there are different variables that some of these results go out with. And so it's very important that you look at your lab results in its entirety. Not only that, there's something that I know is not present in your lab results, but that would even add value to it. Sometimes just knowing the method that was used in testing that sample would make the difference. Because like I said, you could have 20 methods that are by 20 different manufacturers to test for glucose. I would tell you that each of these methods has a limitation. So when you do not understand the results, when you've interpreted it based on the reference range and you still think that is unclear, you reach out to lab to doctors or you reach out to the lab that ordered the test. Like I said, we are trained in the lab, and I do not have to be in the lab that performed the test to help you understand your results, to let you know what the limitations are. Maybe you are questioning the result, maybe it's unclear because the limitations of that test has interfered with the results. So I would say the best thing to do when in doubt, reach out to a lab. If you want to be even faster, reach out to lab to doctors. Do you have anything to add?
Yes, the one thing I would like to touch on this subject is reference ranges, because I feel like people don't really understand how they come about and what they're supposed to be. So for establishing a reference range, we take a fairly large number of patients, let's just say 2,000 patients that are deemed normal, so healthy. We run their samples and then we see what their typical value for a specific analyte is, right? So in the end, we will come up with a range with a low end and a high end, and 95% of our patients that are deemed normal will fall within that range. Now, we have to put that in writing, right? We have to give you a reference range. So the reference range on paper will have a hard cutoff. There's a number on the bottom end, there's a number on the top end. As soon as you cross that number by the slightest bit, the AI portion of the lab, the analyzer will flag that as high or low on the low end. However, just because your lab value is 0.01 above the reference range, that does not automatically mean it's highly abnormal and clinically significant, right? So one thing to keep in mind is always that trends are more important than one specific value. So if that is repeatable and you repeatedly get results that are above the high end of the reference range, even significantly above the range, then yes, that's certainly something to investigate. But what you definitely want to avoid is treating a number or a flag. Just because that thing flagged for being 0.1 above the reference range once, and next time it's back down to normal, that's nothing to worry about.
Okay, that's right. Let's take some questions from the audience at this time, please. Do you want to take a look at them and let's read them? Let's see. Let me see what's in there. It's not coming up. If you have seen the question already, read it. For some reason, I think my network is slow. It's not coming up for me.
Let's see.
Okay, it finally came up. Okay, I see it now. Practically speaking, what is the process for reaching out to lab to doctors with questions based upon lab results, and what is the turnaround time to get a response? If you want to reach out to lab to doctors, you go to the website, create an account, and send a note to us. And when you create an account, there's a form for you to fill that enables you to express yourself based on the test or the patient or your specific question. Again, we do not take your personal information like your date of birth, your name, your social security number. None of those are there. We just need to help troubleshoot your lab results and not take personal information to deal with. So if you go to the website, you'll be able to create an account, and you either get in there as a patient or you get in there as a clinician, and you'll be able to communicate us, and immediately you drop a note there, someone will reach out to you with the information you submit, like your email, your phone number, your question, and then someone will reach out to you. Thanks for the question. Any other questions? No? You want to ask the next question, Caroline?
Yes, let's see where we left off.
I think this is number 7. Okay, let me go ahead and ask it. If two patients have the same lab results, can the interpretation be different, and why?
Yes, so absolutely. Obviously, it's always important to consider clinical background, including baseline values, age, sex, pregnancy, yes, no, medication symptoms, and all of those things. So one example for that would be if somebody, if a 35-year-old athletic, healthy female comes into the clinic, you do your routine labs for the year, the A1C comes back as a 7. And you call that patient back and you're like, did you know you were diabetic? We need to start managing this. That's definitely a value that should alert you for this patient. Now, on the other hand, if you get a A1C of 7 on your 50-year-old obese known diabetic patient who had a A1C of 14 in the past, but now adheres to the treatment plan and whatnot, you're probably going to be very happy about that 7. So it's always important to consider that. Also, supplements can make a huge difference. So for example, if you get a calcium of 10.4 in somebody that is actively taking calcium supplements, then that is reasonable and you can explain it and nothing to worry about. But if that is a patient that has known parathyroid issues, for example, you should be alerted at this point. So clinical context is always very, very important.
I think you said it all. Next question.
Are there unseen factors like diet, lifestyle, or medications that can influence lab results?
Yes, and I'm going to answer this with sharing a few slides with you so that sometimes it helps to explain things visually so that you see clearly what I have to say. So there are situations whereby clinicians or nurse practitioners or whoever is ordering this test is not even aware of the manufacturer. And like I said, every manufacturer has limitations to their test. And so I'll give you a typical example here. The green line you see here, that represents the RNA of HIV-1 virus. The gray arrows you see in that region are medications that affect that region of the HIV-1 virus. But then you have three different manufacturers, A, B, and C. I think I made A twice. The black, the orange, and the blue. There are three different manufacturers. Manufacturer A designs their assay targeting, you look at the arrows from A, right, where my cursor is. They're targeting two different regions on the HIV virus. Manufacturer B in orange targets one region from A and one region that is affected by the medication. And the manufacturer in blue targets only one region. What happens when a clinician, or if you order lab tests with a lab that uses manufacturer in blue, and the patient coincidentally takes medication that would be falsely low because of the pressure that has been put upon that region of the RNA that compromises the results. So it's very important that when you order lab tests, you want to know about the tests you're ordering with respect to your patients. This particular case is those who are on blood thinners that are affected. If you have a patient on blood who is taking blood thinners and they use the manufacturer in blue, that is a problem already because you have falsely low results and it may be false negative for HIV. And so, like I told you about every manufacturer having limitations, this is a typical example of a package insert from a manufacturer. Ferritin is protein that is associated with transportation of iron in the body. And according to this manufacturer, a test that we use, it says that people who either take monoclonal antibodies, sometimes monoclonal antibodies are given to patients who are on chemo, on cancer therapy, or they are used to also sometimes to diagnose patients. If you are one of these patients, they shouldn't be ordering your test from this manufacturer. Another example is when is somebody who is exposed to animals. When you take care of cats and dogs, your system builds up antibodies against, let's say, the cat dander or something from the dog. And if these antibodies, when you order tests and the tests are using the antibodies that you developed from your pets, they also tend to affect the test and cause false results. So it's important. I'm just saying that it's important that you know the manufacturer's test. It's okay to know the lab, but you also want to know the test. There's also issues with poor patient preparation before sample collection. There are some patients who are on Miralax. Miralax is usually given to people constipating, or if you're going for colonoscopy, they give you to clear your colon so the procedure can be accurate. But Miralax has polyethylene glycol. Polyethylene glycol would tend to pull down the antibodies in the patient sample and can cause falsely low results. So again, it's important to know what your patient is taking. Proper preparation of your patients. I cannot overemphasize it, why it's important that we know what the patient is taking and we know what the lab test is prior to even ordering it. It's not okay to say, I am going to use any lab test now. What are they using? What tests are they using? Sometimes if you do not know and you reach out to us, we can answer those questions for you. Thank you.
I think that sums it up pretty well, yes.
So the next question, what role should labs play in helping doctors, nurses, and even patients make better decisions?
Okay, so we touched on a lot of that previously as well. So we talked about the interpretive comments and offering possible explanations for various circumstances in those comments from the laboratory side. Also offering the real-time consults, I think, is crucial, that there has to be a dedicated platform where people can ask for advice, explanations, or, even before they start collecting or even ordering the lab, making sure it's the appropriate lab. And that also goes hand in hand with test utilization and stewardship. So, there has to be more conversation between provider, ordering personnel, and the laboratory to make sure the correct test is ordered as well. So maybe 60 years ago, there were 20 or 30 lab tests available, and that was it. Everybody pretty much knew how they work, what they tell you and don't tell you. But that field has just exploded, right? So there's tens of thousands of tests available nowadays. And it's not reasonable for every single profession to be aware of all those changes and developments, but that's where you need to consult your lab, right? Where the lab specializes in that, keeps up with the new developments, and can make sure you're actually testing for what you're intending to test for, and you get results that are actually valuable and meaningful to you. And one thing I think that also answers the question partially that popped up in the chat is what shift in the lab could contribute how doctors change treating the patient or seeing the patient and explaining lab results. And I think a big factor in that is education. And I have worked for a lot of facilities where the mindset was, we want nurses to educate our nurses, we want physicians to educate our physicians, and so on. And I really do believe that that approach is outdated. We need to have more interprofessional exchange. We need to have laboratory professionals educating doctors um, on subjects that we're the experts in, right? That we can offer advice and insight, and just having a mutual understanding and trying to minimize that disconnect right there.
Wonderful. You've answered the question thoroughly. I think there's the next question for you. Can you look at the chat window?
Yes. How reliable are these tests? What tests exactly are we talking about?
I think she's, I want to think that all the tests in general, like all the
Okay.
tests that the
So,
results that we release here.
all the tests that, end up being FDA cleared and actually implemented in the labs, they do not all have the same threshold, but we're always aiming for a reliability or, somewhere around high, at least 80s, I would say, for sensitivity and specificity. So that is always depending on if you want a diagnostic test. If you want a diagnostic test, your sensitivity and specificity is different than a screening test, for example, when you're trying to rule out. So you need to look at if you're trying to rule in or rule out something, or if you're actually trying to confirm a diagnosis. But all of the tests that are available and orderable, they have surpassed that critical threshold, and they do return reliable results. If they don't, there are experimental or lab developed tests sometimes that do not meet that official threshold. Those will have to be turned out with a disclaimer. The provider will have to be notified that, this is not a FDA cleared test yet. So you have to interpret the results with care. But generally speaking, the results you get on a day-to-day basis are very reliable nowadays.
And to add to what she said, we are all aware of point of care testing, or some of us are aware. Some people have probably been testing glucose with a little strip, at home, or you've done some pregnancy tests at home. We call those tests point of care because it happens right where the patient is. Just so you know, the glucose testing on a point of care device versus what is on the instrument. Now, point of care devices come in different flavors. They come in different methods. So you do not expect to see that the glucometer you had by manufacturer A is exactly what it compares to manufacturer B. If you are using a point of care, be sure that you are following the procedure by the manufacturer to be able to get accurate results. You cannot skip any steps because they've gone through studies to be able to know that if you do this, you would get accurate results. I just wanted to add the point of care piece because I know we are always talking about the lab, but there are instruments that are at bedside of the patient.
Yes. So,
Let's see.
just for looking at the future, where do you see the role of lab medicine heading in the next 5 years, especially with new technologies?
I want to say that with new technologies and all the technologies so far that I see are having AI, implementing AI, I see the lab even becoming a more error-free space. But again, the lab is analytical. The phase that happens before the lab is pre-analytical. I only wish these technologies were out of the lab and not just within the lab. how can we adopt these technologies outside the lab is the question for me, because as far as I'm concerned, with AI and AI is here and here to stay. And they're already using it to come up with algorithms to diagnose cancer, to look at trends in results, and be able to quickly come up with a diagnosis without even, without wasting more time, thereby implying that the patients would be more accurately treated because we have algorithms in place that do the work, that we've trained the algorithms, or we've trained the software to do some of this that we used to do manually. So I would say that results are going to be out faster, more accurate results will be out if we can keep the pre-analytical errors away. And lab medicine and our clinicians and nurse practitioners can even count more on the lab.
I would definitely agree with that. Yes.
So what was the next question? What advice will you give patients that can assist in, okay, what advice would you give patients that can assist in them getting reliable and meaningful lab results?
Okay, so one thing that is definitely important is to follow the test instructions precisely. A lot of times patients will come in and tell the phlebotomist, hey, don't tell anybody I was supposed to be fasting, but I did have breakfast this morning. I'm going to see if I can get away with it. It's not about getting away with it. Like I said earlier, once I get the sample, I don't know what happened pre-analytical. I cannot see that by looking at your blood. It's important to communicate to the patient why these instructions are important, why we need to follow them, and what the consequences could be if you don't follow them. That would probably make it easier for the patient to understand why that is so important. The other thing is to always make sure we have a comprehensive list of your medications, including natural supplements or over-the-counter supplements. One thing specifically to point out here is because many people will just say, well, I'm just taking a multivitamin or creatinine or supplement XYZ, shouldn't really affect anything. But specifically with those, a lot of those supplements contain pretty high levels um, of molecules that will actually interfere with our immunoassays. So even though they think it's all natural, all over the counter, and it won't make a difference, it is important that we are aware of that, and even for providers to put it in the notes, because currently we do not have that interaction with the provider, really. We don't have that conversation, so we will be unaware of that possible interference, and then it's nothing I can look out for. So that's another thing that is important to communicate. Also, to be aware of test timing. Again, I mentioned testosterone earlier. Cortisol is another good and popular example for that. And then also to empower the patient to ask questions. If they feel like they got a lab result back, they saw a provider and the provider said, well, your labs show XYZ and you should be feeling this way or that way, but the patient says that really doesn't fit the way I feel. They should have a way of reaching out to laboratory professionals and asking if there's something else that might have caused the discrepancy, or if there's another possible explanation for that. So I feel like the two most important things are patient education and helping them understand why we're asking for the things we're asking, and then also creating a way for them to reach out, ask questions, and for clarification.
Wonderful. Thank you so much. Our time is up, and in the absence of any other questions, I want to thank everyone who joined us today on the Lab to Doctors platform to learn more about the lab, because our goal is to leave the lab and meet the patients where they are. It's been a long time. We've been sitting in the lab and people really do not know us. But I think that we would be even more helpful to the patients, to the community, if we get out. And that's why Lab to Doctors is out today. For any questions, for any need for certifications for your nurses, any need for continuing education for your nurses or the people in your team, please reach out to Lab to Doctors, and we would not hesitate to meet them and give them the necessary training they need to ensure that we keep pre-analytical errors out of the samples. At this point, thank you and have a wonderful rest of your day.
Thank you, everybody.